Are you a chiropractor with a struggling practice, having a hard time finding and keeping patients? Is your staff falling short of expectations? I'm Dr. Scott Sawyer, and DC Trainings has the answers that you need. So tune in now and find out how.
And what we're talking about today is the DC examination. In other words, this is the exam where doctors, you're going to go in and you're going to evaluate this new patient and find out whether or not they have a subluxation, right? Because a CA can't make that decision. They can't make that determination, but you're coming in the room now, doctors, and you're going to get to do that. And CAs, I know there's many CAs on the call with us today. So CAs, your part is actually going to come after the DC exam, and that will be just as important. So just know your turn's coming up next, and it's nice for the CAs to know what is happening in the room before you go in, right? So I see Celeste on the call. I'm going to pick on you, Celeste, because I was talking to Dr. Knish, but you know that you're a very valuable part of the whole new patient sequence, and with that sequence, we have the memorable welcome and the consultation details and the subluxation education. You're a huge part of that. In fact, you might be doing all of those parts leading up to this DC exam. But then when you leave the room and the doctor comes in and swaps places with you, it's nice to know, what is the doctor doing in there and what happens, so that when I come back around and it's my turn again, there's a new chapter in this sequence for the new for the new patient, right? You want to know what's happening there to keep yourself in the loop. And we'll get into that next week when we cover the CA exam. But for today, we're going to go right into this DC exam because, as it says on the screen, the purpose of this exam is to confirm if subluxations are present and then elevate concerns about their severity. And I'll just sidebar for a second, because I know many of us have run into patients over the years that didn't want to have x-rays, or they wanted to get adjusted on their first visit. And what happens in those scenarios, or the outcome of those scenarios, is important based on how you respond to those scenarios. And we'll talk about that today, because I want you to be in the driver's seat with how this process goes. Now, that was a little scattered, but let's get back on track here, because if that's the purpose, here's what we're going to do. We're going to see the new patient. Our CA let us know that the new patient is ready. And before we go in the room, we're going to review the file, right? We want to get centered around what's going on with this patient. How can I sort of be connected, even though we're not seeing eye to eye or face to face yet? How can I be connected in an innate way with how this person is really suffering? And knowing the power of chiropractic care and the power of the body to heal itself when somebody is under chiropractic care, I want to get my headspace around that, and then couple it with where is this person suffering? Because if those two merge, the power of chiropractic and a suffering individual, obviously the power of chiropractic is going to help that individual to surpass any obstacles in their healthcare challenges or their health challenges and become a healthier person. That's the power of chiropractic. And we know that with certainty in almost any situation, your body's always better off with a good nervous system, with a healthy nervous system. So we're going to pause for a minute to really get centered around that philosophy, or that focus, for lack of a better term. So we want to look at the patient's name. We want to look at the primary concerns and how long they've been there. We want to look at what type of file it is. This is a cash file, an insurance file. We want to know who referred this person. And once we have those in our headspace, now we can go into the room with a real clear presence of mind, and we can make the connection that we want to make with this new patient. Okay, so on the website, which I'll show you in a moment, there is a video here that shows exactly how you want to do this, so you can check that out. But I'm going to keep going. So now that we have our headspace around that, we're going to walk in the room, and I'll read through this, but then we're also going to go over the script today, and I'll show you that. So I'm going to go through this just as kind of the bullet points, but essentially we want to greet the new patient and acknowledge the referral. We want to repeat the primary concern and the original cause. The original cause, maybe if the person came in and said, my headache's been here for a week, but then when we dug a little further, we found out that they've had intermittent headaches for 10 years. Well, then we want to make sure that we know about that. So we're going to repeat that to them. And we want to have the patient repeat the condition. And I know this is easy to gloss over. I've got a busy practice just like many of you, but don't gloss over this, and don't make it intimidating, make it encouraging. So we're going to have them say the name of the condition that we're going to be taking care of them for, just so we know they understand what it is. And let them know and based on what they said, which is obviously the term subluxation, let them know they're in the right place if we find one. See, there's still a big if in the room. We don't know yet because we haven't actually evaluated them. Then I like to make sure I record my findings. And I just had this happen yesterday. So, it's fun that I'm in practice like you and I see these real life examples. But I had a patient who walked in, I walked in with, and he started just talking and basically replaying his entire case history. Even though he had just shared it with my CA, he decided he was going to tell me all about the whole thing all over again. And he started to do that. And knowing where I was going with the process, I was, polite, and I said, hold that thought. We're not going to get into that yet because I'm going to be evaluating you, and I'll give you a chance afterwards to explain more details if we need those. But I think we're going to cover everything. And so he stopped talking, and I was able to start that recorder. And then, fortunately, he kept quiet through the whole exam. And I did the whole thing, which I'm going to show you. And at the end of it, I said, did you have any, I know you had some questions and you wanted to share some things with me before we got started, but now that we've completed that, do you have any further questions? And he said, no, you covered everything. So you see my point there? Recording the exam is really important from a time constraint and for efficiency so that you can stay centered and focused on what you need to evaluate. What I don't want to have happen is have you palpating a patient's spine and thinking, is this where the subluxation is, or is it over here? How much pressure on the nerves is there? How is this body suffering from this subluxation? And really being connected in that way. And at the same time, have the patient talking to you about, well, last week I was, in this place and I was trying to do this thing and my back was hurting that way. And that's a complete distraction. I want you to be fully focused and present with them so that you can get the best examination done and get the information that you need. So we want to record the exam. All right. So we start the recorder. This is a chiropractic exam on April 14th, 2022 with John Knitsch, right? Then we palpate the primary concern first. And this is, I like to give a nice little shoulder squeeze just so that they, because they're laying face down, maybe they're feeling a little vulnerable, a little nervous. Nice little shoulder squeeze just to say, hey, I'm here, I'm connected, I'm present with you. And then I'm going to go right to where their primary concern is and palpate that area first because that is their primary concern. So that's where we want to start. Use deliberate palpation, meaning you want to put pressure there to where they gain confidence in your ability as their doctor. I want to say that again, and you may want to write this down because there's a lot of information that goes through your palpation, and there's a big impression that's created through your palpation in terms of the patient's confidence in you as a doctor without even saying a word, right? Just like, I'm just thinking of my wife. So a mom who puts her hand on her child's shoulder and says, don't worry, sweetie, it's going to be okay, right? And instantly that feeling, for this child, they melt. They go, oh, okay, mom says it's going to be okay, it's going to be okay. That just example came to mind. And the same thing is true in the doctor's office. The patient's nervous. They're not sure what's going to happen. They're anticipating whether or not you're going to be able to help them. So many things are going through their mind. We want to put their mind at ease and allow them to build trust with us, build confidence in us, and actually relax and just start to absorb the experience that they're going through as part of this examination. So to wrap all that up, that's why I say use deliberate palpation. Know that you are creating an impression or a level of confidence through your palpation without even saying a word. So use that kind of palpation to get that point across. I know what I'm doing. I know where to look. I know what I'm feeling. And based on what I'm feeling, I am going to have a very clear impression of what's going on with you in just a minute when I'm done. Okay. Build momentum through the test. So having that frame of mind of what I just said, as you're building that confidence and that trust, See, when you start to connect the dots during your exam, then you can speed up the test. So in other words, you could say, I'm feeling this. Is that what I think it is? And this is not what you're saying. This is just the impression that you're giving. Yep, that's what I'm feeling. Wow, if I'm feeling that, then that must mean A plus B equals C. Yeah, let's go to C. Wow, and C now leads me to D. And based on D, wow, I didn't see that coming, but since it's there, we're going to go to E. And you see how I'm moving through this flow. And again, that flow is building momentum based on the information that I'm gathering. And in the patient's mind, I'm coming to a more firm conclusion about what it is that's happening in their body. And that's the impression I want to give through building momentum during those tests. Use tests that emphasize subluxations. I mean, you can do a whole slew of tests. They taught us a lot of different tests in school, lots of orthopedic tests, lots of neurologic tests. We don't need to throw all those in here. We want to do the necessary tests, and we want to make sure we focus on the tests that are going to emphasize where those subluxations are. Those are the tests you want to do. And I give you examples of that on the exam form. So we'll get into I'm going to show you where the video is, but this is just an example. Here's a patient laying face down. I'm palpating their spine, and that's how you would go through that. Now, this is the point I want to make before we jump over to the website. This exam confirms that subluxations are present. The question mark is still, how long have those subluxations been there? Have they been there for a week? Have they been there for 10 years? That's the next step of what we need to find out. And I said I was going to come back to this because we've all had patients who said, I want to get adjusted today, and I don't want to get x-rays, right? I mean, just as an example. And how you respond to that is very simple. If you choose not to do an adjustment on the first visit, which I actually recommend, and many of you have probably heard me say this before, but if I was to go into an oncologist as a patient and I had malaise, I had rapid weight loss, I had a fever, I had a history of cancer in my family, I mean, all the signs and symptoms that this is a cancer patient, I was over 50 years old, you could look at me as an oncologist and pretty much say, you got cancer. And yet, if I was the patient and the oncologist said, based on what you've just told me and the way I'm looking at you, I'm going to send you into chemotherapy right now. We're not even going to do any tests. We're not going to do any blood tests. We're not going to do any MRIs, no CAT scans. I'm just sending you right into chemo. You would say, whoa, whoa, whoa. I want the tests. I want to know if, in fact, I have cancer. And I want to know, more importantly, how long it's been going on, right? And where it is. See, that's if we want to, and not to compare us with cancer or oncologists or anything, but if we want to elevate chiropractic to a level where people have respect and value and confidence in what you're saying as a doctor, then we want to go through certain steps that let them know this is not just a whimsical, yeah, I could, my friend cracked my neck after surfing the other day because I had a kink in my neck and it feels better, so I'm fine. We want to get way past that, right? So if we want to build value for chiropractic, in my opinion, I think it's important to take the time to do a proper exam, to evaluate those results before we do an adjustment. Okay, so just a philosophy side of things. Okay, so then once that we get through that sequence, so just to go back to it, we're confirming subluxations are present. We're not sure, but there may be some osteoarthritis or some subluxation degeneration. We need further testing to find out where the subluxations exactly are, but more importantly, how long they've been there. And then we want to review the subluxation information. And this, just, I guess, to be totally transparent about it, in my office, because we've got this down so well, I don't spend a lot of time on this. I'll just kind of glance at it with the patient real quick and say, you have these different components here. So I'm going to recommend we take some x-rays, and I'm going to have my assistant come in and do some more tests. If you're still kind of building your confidence about it, or if a patient says, like, I don't want x-rays, then this right here will give you the tools that you need to show them this is why we need x-rays. This is why I'm not going to adjust you blindly without evaluating this first. So the abnormal soft tissue function is a result where is a component of subluxations where there's a rise in temperature from an increase in blood or lymph supply, which can result in swelling and inflammation. So it says disc can, sorry, I'm reading around the camera here, can bulge, herniate, or tear, or degenerate. So if there's swelling, essentially, if you can feel a spot along the spine where there's a subluxation and it's sore to the touch, that right there will indicate a rise in temperature, which you may want to do a thermal scan for that. Or you may say, based on the inflammation, this is not something that just showed up overnight. This is something that's been building up for a while. Another way to build value for the test that you want to do and the process that you want to go through. And a really valuable way to basically add to retention, right? If somebody values chiropractic care to the level that we want to bring them to the way we do, they're going to be a lifetime care patient. They're going to be coming to you literally for as long as you stay in practice or until they move, right? So to build up to that and knowing that that's what's coming in ahead for them in the report of findings, we want to make sure that we get these dots connected. The next one is the abnormal function of the spine and body. So bone spurs and other abnormal bony growths can attempt to fuse malfunctioning spinal joints. Well, that's a reason to take x-rays right there, right? If you have swelling and you have abnormal function where it's not moving properly, and you have a patient who doesn't want x-rays, you could show them this and say, this is the basis for why I'm recommending x-rays. We need to evaluate this further. And usually when they see that, they'll say, okay, I trust you, doctor. Let's do it. Okay. Okay. So after the exam is completed, then I'm going to complete the summary of charges. And this is one of the, and I've said this before, but this is like one of the top 5 forms in DC trainings. The summary of charges and consultation details on the back side is where you put your exam results. So you complete that, and this is what that looks like. So we're going to fill it in appropriately. I'm not going to go through that right now. I'll show it to you on the website. And then I'm going to use the conclude DC exam script to cover this. The spouse must come to the report of findings. We're going to ask 3 questions to make that happen. And I'll show you those. I'm also going to collect a payment or explain that payment so that my CAs can collect it at the front desk. And this adds credibility from the doctor, right? Most doctors out in the pharmaceutically geared sick care arena out there in the world, doctors don't even talk about fees. They're not even proud enough of what they charge. They actually hide behind the curtain and they won't tell you what they charge. It's one of my pet peeves. I really think that we need to be proud of our fees enough to sit down with a patient and say, this is what the cost is going to be. This is what I charge. And I value what I do enough to tell you that because I expect to be paid because I'm about to do something that could be literally enhancing your health for the rest of your life, right? So there's value in that. And it also helps your CAs collect the money at the front desk. So help your CAs out too, doctors. Don't just shy away from saying, here's what the cost is going to be for today. Help your CAs out so when the patient gets up to the front, your CAs can collect that money. And then decide if pre-ROF visits are needed. Now, we just had this happen this week. I had a patient who was here yesterday as a new patient. We don't see patients on Thursdays. So he wasn't going to be able to come back for his report of findings until tomorrow, Friday. But he was really hurting and he wanted to get adjusted yesterday. And so I let him know, we're not going to do an adjustment today, but I will be happy to see you tomorrow, which is Thursday. And that'll be an adjustment before we get to your going over your results, which is the report of findings, right? So decide if that's needed, because if it is, you're going to let your CAs know, and then you leave the room. Okay, so that's the sequence. Now let's go into some of the overall, general factors in this process. So the key points are we're welcoming the patient and then we're putting their mind at ease. Whether we help you or we have to refer you out, either way, you're in the right place. Now, ultimately, we know we can help them. If they have a subluxation, they are in the right place. The costs are explained by the doctor up front. Patient assumes that a professional office will probably be expensive, right? You've got a professional office, everybody's well-trained, everybody knows what they're doing, they know what they're talking about, but they get a good surprise when the fees are reasonable. So don't blow your new patient out of the water with some expensive upfront fees for the exam. Make that a shoe-in to lifetime care. Make it just, okay, there's a cost, we value what we do, it's not enough to break the bank. We're gonna lose the battle maybe on the front end, but we're gonna win the war in the sense that the patient's going to leave feeling like, yep, I got value for what I paid for, and I'll be back so I can get started with my chiropractic care. So this entire process takes about 10 minutes, and it emphasizes the connection that you're going to make with your new patients. That real strong bond where they've built trust. You've earned their trust. You've earned their confidence. You've shown your knowledge. You've shown your ability to provide the care, and that's an important first step. So next week we'll be getting into the next section, and CAs, it's going to be your turn to go through all the high points of your examination. So that'll be next week. But let me just jump over to our website for a moment, and we'll finish this section out first. So here's our dashboard at DC Trainings, and I want to just share something really cool with you. We're actually working on a facelift with DC Trainings right now. I've got some really fun stuff that's coming. I've been working with 2 different companies in terms of getting everything organized, and I've been telling you about the emails and so forth. So I'm really excited about some of the changes that are coming up. I'll tell you more as it gets developed, but I am excited about it. So you're going to see some of these cool things that come out of this. So let's go through these forms here. So here is the examination details. Let me shrink this down a little bit. So part of why I created this in the way that I did is because I want you to be able to quickly document your exam findings after you finish your exam so that the patient doesn't have to wait too long. So that's set up in this way, where we're literally the only part that I'm filling out as a doctor is this part here, this little section, and this part over here for right now. Later on, I'll fill in the results of X-ray if those were taken, and my CA will fill in the results of the CA exam. That's up here. So literally, how long would it take you to just fill this in right here, some pluses and minuses over here, and tenderness to palpation, that's what that stands for, and then listings for where you found their subluxations. It's less than 30 seconds, and that's it. So it should be short, sweet, to the point, but at the same time, you obviously need to document everything. These columns here are for subsequent exams. So when you do their progress exams, that's what you'll fill in over here. So that's a sample for you. That's on the website. It's right over here, examination details. The blank one, you can fill it out. And then, of course, the detail with the samples. And then here, this is the script I want to show you. So this is the DC exam script. It goes through the points I was talking about. I'm Dr. Sawyer. It's great to meet you. See, I'm acknowledging them by name and by who referred them, right? And then so we would acknowledge the referral. And then here, the patient says, I hope you can help me. Maybe I better just read through this. I'm not going to read through the exam part because that's down here and you can read that. But what I want you to get from this is I'm relating the primary concerns and the duration, right? And then I'm asking the patient to repeat the name of the condition that we're looking for. So the patient said it. Yes, it's called a subluxation. And then I say, if that's correct, if a subluxation is present, I'll be able to help you. If it's not, I won't, right? So that's where you're in the right place, whether we help you or whether we refer you out. Either way, you're in the right place. So that's why that says that there. I'll be tape recording my findings for accuracy, lay face down on the table, and then I go through this recording of what my palpatory findings are. And the way I'm saying those out loud is really kind of an eye-opener for the patient. So at the end of it, the patient says, wow, doctor, am I going to be okay? That sounded pretty serious. And I'm not going to say, yeah, you'll be fine, because I don't know yet. I don't know how advanced their subluxations are. I don't know, once I get the x-rays back or once I evaluate everything, I might find they have spinal fusion. I don't know yet. But I can say, because I have found a subluxation, that you are in the right place and I need more information. So we're going to continue with those tests to get that information. And then down here, let's see. I've confirmed at least one subluxation. I need to order additional tests, and then you move into those tests, okay? I want to show you this here. This is where I was talking about the summary of charges, and this is what you're marking down as far as the services that you did. This part here is important. Well, actually, I guess there's a few of them, but here's the charges, which now, doctors, you're going to be going over that with the patient briefly and letting them know what the costs will be. Here is who they're going to come back to the report of findings with, which I'll show you in the next script. And then here's the instructions for your front desk. I want to provide icing instructions. I want to provide a notice of appointment for the patient to be able to leave work if needed. And I want to schedule pre-ROF appointments. Okay, so use this to your advantage. This is a super efficient, streamlined form that will help you to really dial in the end of your exam without taking too much time. So let's jump over to this next one, because here there's a lot of buckshot, as they say, to this conclude DC examination script. So your exam shows that you clearly have subluxations affecting your spine. Doctor, the things you said sounded pretty serious. Am I going to be okay? Yes, but there's a lot of swelling, which indicates possible degeneration. I'm going to ask my assistant to do some additional tests to determine how long this condition has been progressing. I'll study the results carefully, and then I'll discuss the results with you at another appointment. Will you be okay if that's in a few days? No, I'm in a lot of pain, and I don't want to wait that long, right? Think about that example of the new patient I saw yesterday. In that case, I'll request an appointment at our soonest opening. And then footnote down here says, if needed, schedule pre-ROF appointments. Okay, I sure hope you can help me, doctor. I'll do my best. Is your spouse, now here's the 3 questions I mentioned, right? The 3 questions. Is your spouse aware of how your back pain has affected you? Yes, he hears me complaining about it all the time. Would he be willing to help you with exercises at home to get better faster? Well, yes, of course. Would you agree then, this is question 3, that he should return with you so I can show him how they, being the exercises, can help? Yes, we might both need some instruction on how to do them correctly. Good. I'll ask my assistant to schedule the appointment for both of you together. It's very important that your spouse to be here with you. Your cost for today's appointment is $95. Can you take care of that before you leave? Yes, I can. Thank you. And wait for my assistant. And I can't get that. I guess I can. There we go. And I'll see you next time. I know I can help you. So we covered all the different components of what's on that summary of charges, right? We're going to have icing instructions that go home with them. We're going to have them come back with their spouse. They're going to need a notice of appointment. We're going to schedule pre-ROF adjustments, which we'll get into when we get into the report of findings in module 3. It's all on that form. That goes to the front desk, which arms your CA. So your CA has a piece of paper in their hand now that they can use to say, okay, patient, here's what we're going to do as far as the next step. It relates what happened in that conversation that you had with the patient, doctors. So don't gloss over that form. It's really a valuable one for you. Okay, so those are those forms, and then here you can see the videos that we have for preparing for the DC exam, the demonstration of the DC exam, and then an intro video. I had a question about fee increases, and this was a great question from one of our members, but I answered it a couple weeks ago. So you may want to go back to the person who wrote that question. You may want to go back and listen to the webinar from 2 weeks ago where I talked about my recommendations for increasing fees. But suffice to say, I think that it's important to have individualism with your patients. So anytime you're making a dramatic change in your practice that's going to affect all your patients, like a fee increase or like a schedule change, talk to your patients individually first. Let them know it's coming. It shows them that you value them and their input and their feelings about these dramatic things that might affect ultimately their relationship with you. So just my recommendation is don't make a policy change without getting all your patients on board first. So I thought I would just read this story to you. This is really powerful. It says, if you put 100 black ants and 100 red ants in a jar, nothing will happen. But if you shake the jar, the ants will start killing each other. The red ants will believe that the black ants are their enemy, while the black ants will believe the red ants are their enemy, when the real enemy is the person who shook the jar. The same is also true in our society. Before we fight each other and go against each other with all this pressure that's being put on us, we have to ask ourselves, who shook the jar? Now, I read that as I started my orientation class on Tuesday night. And we came back to it and we had a discussion after the class about it. A lot of people wanted to stay afterwards and talk about that story about the ants and what that means in society. See, I think we're all feeling that kind of pressure. And so, just for us in chiropractic, we're so blessed because we can really push all that noise out of our lives and out of our environments when when our intention is purely to just serve our patients, to bring them the joy and the beauty that comes from living life from a subluxation-free perspective, living a life without fear, and knowing that we are doing everything in our power and everything necessary to maintain optimum health for ourselves and those we love and care about. And that is the driving force. And when you look at it from that standpoint, you think, you know what, it's not me shaking the jar. I don't care. What I'm going to do is I'm going to get along. I'm a red ant. I'm going to get along with the black ants. I'm a black ant. I'm going to get along with the red ants. I'm here to work collectively together and to pull forward and to raise the level of health in my community and raise the level of success for all the individuals in our community. And that's where what's been so great about being a chiropractor in this pandemic and for 25 years now, actually, is that we have that clarity of purpose. We have a clear vision of our role is to help people. The color of your skin is no different than the color of your hair or your eyes, in my opinion. It just doesn't matter. If you have a spine, I'm going to take care of you. And people come in with these fears, but when we do our DC exam correctly, when we do follow the steps that I've shown you, you're going to see this congruency between the philosophy of chiropractic and the patients that you attract. And that blend together is going to build you a huge practice. It's going to build you the practice of your dreams, whether that's huge in terms of thousands of people or numbers of people, or whether that's huge in terms of your fulfillment of how you feel with the people that you take care of. Either way is fine. Just know that our philosophy is so right on right now, and it is so needed by so many people in our community. So I just thought that was a fun story to share with you. I don't see anyone else with your hands up. So I think I'm going to go ahead and we're going to skip over the questions if we don't have any today, because I really enjoyed this time together. And I thought that was just a great story to finish up and to hopefully motivate all of us to go out and take care of our patients with passion and commitment and stay true to the chiropractic principles and philosophy. So I will look forward to talking to you next week. If you have any questions in the meantime, just email me, dctrainings@gmail.com. And as always, just stay the course, keep smiling, and have fun. Talk to you next week.
If you would like to become a member of DC Trainings, be sure to head on over to dctrainings.com to get started today.